Yes, we can measure this on ultrasound scan as well, right? Cool. The purpose of discussing the station in detail is that I can give feedback in 1 or 2 lines and I can end the story finish. But actually, you know that I'm habit of digging out things in detail, and I think so. We will discuss 2 to 3 stations in this session, but these should be completely passing station, right? Then they get the benefit of the session. Fine. Should we move to the next station? Who is the next participant, please?
Can I do, ma'am?
Who is this side, please?
Ravneet.
Ravneet. Sure, Ravneet, let me start the station. And that is also one of my favorite station because that is also very tricky. Who is going to start the timer? Should I start the timer? Any volunteer, please? No one.
Yes, ma'am, I will start.
Who is there?
Makbul Fatma.
Makbul, please start the timer, my dear. So 1, 2, 3. Ravneet, your time is start now, 2 minutes, right?
Yes, ma'am. Next slide, ma'am.
This is the only slide.
Okay.
You're done?
Yes.
Okay, start.
Hello, I'm Dr. Amit, one of the doctors here. How would you like to be addressed as?
Yeah, I'm Jennifer.
May I confirm your age, please?
Yeah, I'm 25 years.
Jennifer, I can see that you're into your second pregnancy and you're here to discuss some reports. Is that right?
Yeah, exactly.
Okay. So surely in the next few minutes, I would like to address your reports as well as any concerns. And before that, is it okay if I ask you a few questions?
Yeah, sure.
Jennifer, may I know, do you have any concerns?
Actually, midwife has done some blood tests for me and she has referred me to you to see there's some problem in that.
Yeah, I will come to that in a short while. Before that, can I ask you questions?
Yeah, sure.
So, Jennifer, can you tell me how had been the pregnancy so far?
Pregnancy is going very well.
So, all the scans done till now, are they normal?
Scans were normal, yes.
Okay. Do we have a name?
Yeah, he's David.
Okay. And how is David kicking?
Fine.
Do you have any history of increase in blood pressure during this pregnancy?
Not much. I don't know. No one has mentioned.
Okay. And any history of bleeding from any cuts or wounds?
No.
Okay. Any history of gum bleeding?
Not at all.
Nosebleed?
No.
Can you tell me more about your previous pregnancy and delivery?
Yeah, actually, previously I delivered vaginally. At that time, my blood pressure was raised, and they have given me some medicines to bring it back to the normal. It was fine. Even I had some bleeding at the time of delivery, but they given me some medicine, and then I was fine. It was like not very traumatic, but yes, this was happened in the previous delivery.
Okay. Was it normal delivery or cesarean?
Yeah, vaginal delivery. Yes, normal delivery.
Okay, all right. And do you have any medical illness?
No.
Are you on any medications except pregnancy supplements?
Yes. I'm taking aspirin
Mhm.
from the very beginning of pregnancy.
Mhm. Okay, all right. Any history of surgery in the past except cesarean?
No,
Any allergies?
no,
Any family history of concern, particularly clots in the legs or lungs?
no.
Do you smoke?
Yeah, I used to smoke before pregnancy, but now I'm not smoking.
I appreciate that. Okay. Do you drink alcohol?
No,
Pardon me asking, any recreational drug use?
not at all.
Are you well supported at home?
Yeah, that's fine.
And your weight to height ratio?
It's 35.
Okay. Your blood group?
It's A positive.
Any reservation for blood transfusion if required?
No,
And are you feeling depressed or low mood in the last few weeks?
no, I'm fine.
Okay. So thank you, Jennifer, for the information provided. Now coming to your blood reports, I'm having a lot of information to give it to you. I can see that you're alone. Do you want someone else to be with you?
No, it's okay. Everything is fine.
Yeah. Okay. So I have seen your blood reports and I have confirmed your name and NHS number. And these have shown that certain type of cells which are present in the blood we call as platelets. Do you have any idea about it?
No, what does it mean? What's
Yeah.
wrong with me?
So these are okay, I tell you, these are certain types of cells which are basically responsible for uh, clotting. Like whenever there is any injury or cut marks or during surgery as well, the blood flows. And in order to decrease that blood flow, these are responsible for forming the clot, these cells. The normal range is more than 1.5 lakh, but in your case, it has come to be 75,000. This
All
condition we
right.
call as thrombocyte. Yeah,
So, what do
yeah.
you suggest, doctor, that it's going to affect me and my baby?
Coming to that, this condition we call as thrombocytopenia in pregnancy. As
are not that much reduced that they are going to affect you in an adverse manner. Hello?
Ravneet, please come close to the mic. Your voice is very feeble.
Hello? Am I
Yeah,
audible,
yeah,
ma'am?
yeah, you're audible now. Please continue.
Yeah. So, as of now, the counts are not that much decreased that they will affect you and the baby adversely. But still, I would like to connect with my consultant as well as the blood doctor. A team of doctors will be involved in your care, including consultant obstetrician, blood doctor, physician, and experienced midwife. We will be consulting with the sleep doctor as well, that in case any kind of like anesthesia is required, so we will be taking an input from them as well.
Okay.
Secondly, I would also like to tell you that as your weight to height ratio is on the increased side, it can have certain implications in pregnancy. Are you aware of that? Has anyone earlier discussed?
Yeah, my midwife has told me that my just height to weight ratio is high side, but I don't know. I can't do it anything now in my pregnancy.
Yeah, right. So we are here to help with that as well. Like you are approximately 33 weeks in pregnancy right now. So because of increased weight to height ratio, there is increased risk of having delivery before time. Even the waters may break before time, and then the labor may get prolonged, increased risk of cesarean sections and back passage tear. And also the baby can have certain difficulties after delivery.
Okay.
So you will be your delivery will be in the consultant-led unit, and one-to-one care will be provided to you. We will be continuously monitoring the baby during labor. We will keep you well hydrated
Doctor,
and
this
mobile.
the situation that you have told me, that you are saying me that I am having some sort of thrombocytopenia. So can you tell me that what is the cause behind it? Why I am having this?
Generally, it can be a innocent condition during pregnancy that the counts they decrease, but we will like to evaluate you for that. We can like if there is increase in blood pressure, or we will be checking your urine for proteins as well, because in such situations also the counts may decrease.
And
I
will
will
it
be
affect my plan of delivery or labor? Because previously I delivered vaginally, it was a normal delivery. So will this condition affect on my labor?
May I know any preferences for delivery? What do you want? Have you any idea?
Yeah, definitely. I was delivered normally in my past pregnancy. So this time also I prefer to deliver normally.
So this much count will not affect the delivery process as such, but I will get back to you after discussing with my consultant as well. At this much count, we can offer the pain relief by giving an injection in the back as well.
All right.
Yeah, I will be giving you the written information regarding all this, and will be informing my consultant right back to your GP. And if you feel any kind of heavy bleeding or bleeding from cuts or wounds, and then you can come to us immediately.
All right, fine. Okay.
Yeah. So any question you want to ask?
No, it's okay. Thank you, doctor.
Okay, thank you.
Doctor, one more point I need to ask. Is there any medicine that I use to make the count up? Is there anything that you can do to make the count better?
Unfortunate, no. I will get back to you after discussing with my consultant.
All right. Fine. Thank you so much, doctor. Thank you.
Okay.
Thank you
25
so
seconds
much.
left, ma'am.
I don't know. Actually, I didn't know about the station.
Ravneet,
I have
and
no idea
all
about
of you
this.
friends, Ravneet, you did very well, my dear. You were very composed, very calm voice, and very comfortable with the patient, right? But still, to pass the
But
station,
I was not.
you cover
I
many.
was not having any idea about the station.
Thrombocytopenia, you people have not done yet?
I haven't done actually. I haven't.
All right. So many the other friends, what about you people think about this station? Anyone has done this station before?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Yeah, this is a recall station, and this is a very important station, and it's coming again. Just a minute. Ravneet, coming to your
Yes,
good point that you covered very well, and you covered that can make you go fail in the station, but you covered, is this that you have asked me about the fetal movements. We usually consider that the question of the fetal movement is a casual question, right? And we just are asking to build a rapport building, but it's not the case. Actually, the asking the fetal movements comes under the patient's safety. It can make you fail the station if you will miss this question. In any pregnant patient, in any antenatal patient, if you miss this question, that how the baby is moving at this time, you are going to fail the station regardless of how perfect management plan you are giving to her. Because she can have an IUD at that point in time in her tummy as well, right? And you may have missed that. So missing the fetal movement question is a huge mistake that no one can understand. No one is getting recognized that this is a so important question. And fortunately, you have touched that. You have asked about blood pressure, proteins, bleeding, gum bleed, nose bleed, right? You have asked about medicine. I have told you that I am taking aspirin, but you have not inquired further that why I am taking aspirin. Who has started me, why they have started me aspirin. Like every patient is not taking aspirin, right? First point is,
I just assumed, ma'am, because you said in the last pregnancy there was high BP.
okay. Listen.
So I,
just let me, yeah, you're absolutely right about that. Second thing, the very important points that you touched, being this an antenatal patient, is blood group you have asked, any reservation you have asked, mental history you have touched. This is a very good point, right? Breaking bad news is if you're making it a routine, it's fine. Otherwise, sometime it's not affecting your score, right? Because it's not a very huge bad news for the patient, but still this is a concerning thing for her. But if you are mentioning it, there is no harm in that. But if you miss it, it's not going to make you fail. The things that can make you fail in the station, and I have just discussed, Ravneet, I have just discussed that you should mention red flags in the very beginning, particularly for the patient who is having low platelet counts. You do not know that in the next 2 weeks, in the next 1 week, she can have the platelet count of 50 as well. So you should mention, you mentioned the red flags, but again, you mentioned the red flag at the very last moment. I'm again and again emphasizing on this point that immediately along with explanation of the situation, mention the red flag signs so that you will not miss the passing marks in the station. Because even you leave it at the very end point, you know that sometimes patient can ask 1 or 2 more questions. Patient can sometimes say that I'm not understanding your, can you please elaborate it further? And you have to explain again and again. And your time will be, more time will be consumed, and then you will be left with red flag signs. And in thrombocytopenia, red flags matter a lot, right? You cannot pass the station without telling the red flags. And what are the red flags in this particular patient? You will tell the patient that if you are having any headache, blurring of vision, if you are having any vaginal bleed, if you're having bleeding from gum, nose, you should immediately report to us, right? Please, friends, mute your mic so that I can take this forward. I will cover the station fully. I'm just giving you feedback, right? Second thing is that my BMI was 35, right? You have discussed many things about increased BMI. Delivery will be will be before time, labor will be prolonged, back passage there, everything you mentioned about BMI. Actually, the thing is this, the only one point which can make any clinician pass or fail in the life scenario as well and in the exam situation is this, whether we are starting or we are stopping the safe medicine or not. You should have been stopped aspirin until and unless you will discuss with your consultant, you should have stopped that aspirin, but you have not stopped. You should have told me that, Jennifer, I will discuss with my consultant, but until and unless I will discuss, you should stop taking aspirin. And you will not take any painkiller medicine. NSAIDs and aspirin will not be given until your thrombocytopenia is getting settled or until I will discuss with my consultant, but you should discuss this thing. You should touch that point. Examiner should be knowing that you are worried about this thing, that now patient is having thrombocytopenia. Now, which medicine? Any medicine. I purposely have, like in this recall question, they have purposely added BMI of 35 and aspirin. Not because you should tell about all details of the increased BMI. You have told me 3 effects of the BMI. Anyone can tell 10 as well, but there will be no marks for that. The purpose of the BMI and aspirin is that to check that whether you will stop or not, right? So you have to stop, because stopping a medicine will make you a safe doctor. Patient safety.
Ma'am, one more thing, like with relation to platelet count and BMI is that since she's 35, then, you know, we need to like anesthesia, epidural. So those things we have to tell that if further we'll be monitoring your platelet count. If it is further decreased, then that could be, means there is a basic level where it could be given or not given.
See, telling the patient, I will tell you, I have made all the slides and I have not covered only the station in exam perspective in this manner that your knowledge will also be complete after this session, right? I have made the stations in this manner that your applied clinical knowledge will also be covered. But to tell the patient of all the values that less than 20, we will do this, less than 50, we will do this, less than 80, we will do this. This is not very important. Patient has nothing to do with this. It's not going to affect anything like this. The most important thing is telling her the red flag signs. And the most important thing is to tell her that you have to stop these medicines. These 2 are the patient safety points. And I'm telling you the points from the examiner, right? I have I am in a process of being an examiner. So these are the points that very few people will tell you, that these are the passing and the failing points in these particular situations, right? Be very careful about it. Telling the patient that on 20 we will do this, on 80 we will do this, we just tell what target we want to reach, right? I will perform the station for you. Just wait for a while. I will complete the station for you. I will just discussing that what Ravneet has been, it has been better if she has told these particular points. Now coming to starting the station from the very beginning, we will, Ravneet has given a very good introduction. She was very composed and her talking with the patient was very comfortable. But to pass the station, in every station, make a red circle or a red box, and on that red box, write the points that in any case you need to touch in the first 2 minutes or in the first 3 minutes, right? Now, again, confirm the patient's name, identity. What is, may I know your, may I confirm your name and age, please? And what are your any special expectations from this consultation that you are having? And if you're sent by your midwife to discuss the reports, I will discuss with that. I will discuss all the management plan with you. I will document all the discussion. I will take an appointment from my consultant, write back to your midwife. I will also give you patient information leaflet. Because these things have got points, so it is very important to cover there and then. Do not leave it until at the end, right? But still, sometime wasting too much time over agenda making can make your time less. So do not waste a lot of time over there, because missing a patient information leaflet in thrombocytopenia may not make you fail, but missing red flag if you will leave it for the last moment can make you fail. So do not waste your lot of time in agenda making and all the things. Just make quick story of yours, right? And finish it there and then. Then starts the information gathering. Now there will be causes. What are the causes of thrombocytopenia? Hereditary thrombocytopenia. Is there any, first of all, how is pregnancy going so far? Combination of open and closed questions. How is your pregnancy going so far? It means, okay, Jennifer, no pain, bleeding, leaking right now. Have you named the baby? Is the baby moving fine, right? Okay, any history of gum bleed, easy bruisability or rash? Nothing? Okay, that's fine. Any raised blood pressure? Have you ever been diagnosed in this pregnancy? Any history of viral rash, infection? Are you using any particular drugs or medicines? Then she will say aspirin. May I know that when it has been started, and do you know that why it has been started to you? Okay, in the previous pregnancy, how was you delivered? Blood pressure was raised at that time, any medication was given? Okay, all right. How have you been feeling in the past few months? To rule out the causes, these are the questions to rule out the causes. Any raised blood pressures in the proteins to rule out help? Any history of viral infection, because HIV and cytomegalovirus, these are the two viral infections which can cause thrombocytopenia, right? And along with that, then her past history, definitely we are going to do. Then in her management plan, in her examination, you will see that, can I examine you in the presence of chaperone with your permission? I just want to feel for your tummy. I just want to see that if there is any rash or if there is any petechia over there, right? So just a touch of examination, right? And then you will start her management plan. It means in the history, it is very important to rule out the causes. Hereditary thrombocytopenia, HELP, viral infections, bleed, nose, gum, right? All these are the effects and the causes. Again, in every history, rule out causes, rule out effects. Then explanation of the situation, and you have done a very good explanation of situation. Then you can add further in explanation of the situation is this. Jennifer, actually there can be many causes of fall of these platelets in your blood. These are the cells which can make the blood clot, right? We call them as platelets. Most common cause is, which is related with the pregnancy, which is called gestational thrombocytopenia. Almost 75 out of 100 patients are having this condition, right? And their count remains normally high and more than 70. You can say 70, or it's not, it's okay if you will not mention the number, right? Other causes can be related with your antibodies. These are the proteins which are formed against our own body cells, right? This is called autoimmune or immune thrombocytopenia purpura. Sometimes there can be a cause related with a raised blood pressure. Sometimes it could be because of running a condition in the family. Sometimes it could be a viral infection as well. So you know that, Jennifer, there can be multiple causes, but we cannot exactly figure out at this point in time that what is exactly the cause. But what we are going to do is that it can have some effects on you and your baby. You can have fall in the platelet count so that you can need medication. Baby can have some bleed inside the brain at the time of delivery. But remember, Jennifer, even after complete treatment, and even you will be completely monitored, even you feel that you're having gum bleed, vaginal bleed, you're having headache, blurring of vision, please immediately get back to your pregnancy unit, right? Immediately get back to your midwife. Immediately get back to your antenatal care unit. Immediately cover the red flags over here. right? These all can be the cause. We cannot figure out at this moment that what is exactly the cause, but we will monitor your levels regularly at 1 to 2 weekly interval so that we can keep it in a safe target that is more than 50. What we can do is that we will involve a specialist team of doctors. Your care will be in the obstetrics unit. That will be shared care between our consultant, specialist doctors, which are called hematologist or the blood specialist, right? They will be managing your situation at this time, and they may need to start certain medicine, which is called steroids, or certain injections, which are called immunoglobulins. They can help you to raise your platelet levels, right? But they will decide that whether it is needed or not. Then we will continuously monitor your blood pressures, proteins, and 1 to 2 weekly, after 1 to 2 weeks after delivery, they will come back to the normal. But most important thing, Jennifer, that I want to discuss with you is that we need to stop certain medicine until and unless we are doing our consultation with a consultant and the blood specialist, right? Because these medicine can have some bad effects. Regarding your delivery will be in the obstetrics unit, in the consultant-led unit, along with a shared care, but your assessment with a sleep doctor will be done. It is very important to have your consultation with a sleep specialist because she may need or he may need to give an injection in your back, right? So it may not be suitable at that point in time if the level of platelet is less. She may need to avoid some injections in the muscles, right? So all these points are very important to touch, right? And in this manner, we will take your pregnancy journey forward, continuously monitoring your levels. Depending upon the need, we will give you steroids or immunoglobulins. And then at the time of delivery, we will plan for the vaginal delivery, taking the precautions for the baby, right? If the levels are less, then we will avoid certain procedures on the baby. And after the delivery, then 1 to 2 weeks, after 2 weeks, we will check the levels. It will become fine, then it's okay, right? And then if any of the red flag sign will develop, you can come back to us, right? I will give you this patient information leaflet, and I will document all the discussion that we have done in your notes. If you have any other concern, you can ask me, right? This is the way that we will complete this station. When she will ask, will it affect my baby? Then we can say that actually if the cause will comes out, some special proteins or the antibodies that can be responsible for this condition, they can cross the afterbirth and they can cause the fall in the platelet levels of the baby as well, right? And it can rarely cause brain bleed, but it's not very common. We will check the levels of the platelets in the blood of the baby immediately after the delivery on day 1 and day 4. Then depending upon the levels, then further management will be done. But you don't worry about it. Your levels are still safe, right? So telling her about all the causes, that most probably you will having a condition which is related with the pregnancy. This is how we speak about gestational thrombocytopenia. We will not say this is innocent condition. This is not innocent and malignant and anything like this. We can say a condition, gestational mean related with the pregnancy. You can have a fall in the platelet count that is related with the pregnancy. You can have fall in the platelet count because of some antibodies or the proteins against your own body cells. You can have fall in the platelet count because of some high blood pressures, some viral infections, or some medicines can be the cause of this. No need to mention a lot of long list, right? 1 or 2 things are more than enough. Then your red flag signs, your MDT will be covered. We will be checking your blood platelet levels regularly. And according to that, if need will arise, then they can give you steroids or the immunoglobulin. These are the tablets. These will be started. No need to mention the dose, that it will be started from the dose of 20 milligram, then increase to 60 milligram, 4 tablets, 3 tablets, tapering off, tapering on. No need to mention a lot of these things, and you will not find any time about all this. But you should mention the name. You should mention that we will be keep you under monitoring, right? And our target level is to keep more than 50. Anesthetist review is the passing and failing point. Stopping the aspirin and NSAID is passing and failing. Missing the red flag is passing and failing point in this station. All this story is not passing and failing the point in this particular station. This is how the station of the thrombocytopenia will go. These are all the causes of thrombocytopenia mentioned in the TOG article. I have entered so that you do not need to go back and see the TOG article, right? This is the reason I have actually included it in this. Actually, the people who are already taking my part 2 regular course for July exam, they know that my slides are actually complete package, so that no student has to go back to open patient information leaflet or to go back and open the TOG, right? I make the slides in this manner, that whole station, everything is concised and complete on this. You will go back to these slides and station will be done, right? So these are the causes, no need to mention, just go through this in one go. Gestational, ITP, HELP, viral, right? No need to discuss everything. Features of gestational thrombocytopenia: count will remain more than 70, not associated with bleeding, no other high hazard. These are routine pregnancy, routine care will be provided to you, right? These are the targets that somebody was talking about, but no need to mention with the patient, right? We will say that if there will be a dangerous fall in the level, then certain things will be avoided at the time of delivery. Otherwise, these will not be avoided, right? This is the basically taken from the TOG article, that what is exactly the gestational thrombocytopenia is. Normal levels are 150 to 400. And if it is less than 150, we call it as a thrombocytopenia. So this is all about the station of gestational thrombocytopenia. Now, how is this, Ravni?
Yes, ma'am.
Thank
Very
you,
well.
Rekha. Thank you,
Yeah, I was
Rekha.
missing a lot of points.
No, you are not missing. You were not guided properly, right? This is
Yeah.
not your fault at all. If you are not being guided properly, it is quite normal to miss many things. This is the reason that I am telling you that, like in the part 2, taking the proper source is important. In the part 3, taking the right guidance is very important, because you know that many students believe that talking in a perfect manner can make you pass in the exam. No, only thing that makes you pass in the exam when you are knowing that these are the passing points and these are the failing points. Only this will make you see. If you thank you, Meda, thank you, Saroja, thank you, Makbul Fatma, thank you so much, my dear. You know that my slides are a complete package. In this, all the information that you will not have to open anything again, right? Thank you, Deepika. Thank you so much, my dear. Actually, you people are not in touch with me, but my part 2 students are in very, very much in touch with me, and they're waiting for this, that my part 3 sessions will be a lot of fun. Yeah, Chetra, definitely you will do. One more station I'm left with. Thank you, Shaista, my dear. Thank you, Tanya. I'm left with one more station. Actually, you know that I enjoy a lot while discussing. So anyone, you people will decide yourself. I can't decide, please.
Ma'am, here if the patient asks if aspirin is the cause, what should we say?
Aspirin is the cause of fall in the platelets.
If she asks this question, like if it is the cause.
Aspirin is probably not the cause, right? But we can say that yes, many medicines can be the cause. We will just tell each and question the role player will ask will only those questions that I will tell you, right? I will not miss a single question that you will go in the exam and you will say that, ma'am has not told us and the role player is asking some question from nowhere. No, he or she will not ask any question that I will not tell you, right? This is my promise. Because this is the purpose of taking the session, right? If I'm unable to tell you the right question, then what is the fun of taking the session? But the important thing is that you have to stop the medicine. See, in the exam, whenever, listen, whenever the role player is telling you any name of any medicine, just think about it, that should I stop it or not? Because they have purposely included that medicine. The other thing is that whenever any patient is eligible for aspirin, she will say, I'm allergic to aspirin. Whenever a patient is suitable for catheter, she will say, I'm allergic to latex. This is the rule of exam. This is a strange rule. They will become allergic to anything you will recommend them. They will immediately say, I'm allergic to that, right? So this is the rule of exam. If they're mentioning any medicine, there is a hidden agenda in that. They want you to stop that medicine. If you will not stop this medicine and you will do all the management of the patient, patient unfortunately will go fail. Patient unfortunately will go wrong, right? So the purpose of taking the right guidance is this. You should be knowing that these are my passing points. I have touched that. I am going to pass this station, right? No matter what anyone else is telling you. All right. So let's move to the third station, and that is the last task. But definitely do not worry about anything. I will get back with some other stations as well, right? What is the exact Rekha and Deepika? What is the exact date of exam in the
14 May, ma'am.
14th of May, right? Okay.
No,
Please
ma'am.
arrange a session on the labor ward, please, ma'am.
Labor ward prioritization.
Yes, ma'am.
Actually, that is the most easiest station, you know. because everyone knows.
But ma'am, you make the things more simpler for us, I think.
I make not only simpler, I will take you exactly to your scorecard.
Yes, ma'am. Yeah, you are right.
I will not revolve you here and there that, yeah, please speak very politely, please speak very good manner. No. I will make you pass the exam, because people are taking so many courses and still, unfortunately, they're unable to, because in every circuit, they're passing only 1 or 2 students. You believe me? They are passing only 1 or 2 students. This is a very difficult situation, because students are not knowing where they are passing. 3 points in this station: red flag sign, stop aspirin, right? You will pass the station. Forget about everything. Now let's start the next station. Who is going to do the next station, please?
Me.
Who is me?
Chaitra, ma'am.
Shaista?
Chaitra.
Chaitra. Okay, Chaitra, first of all, assign one of your friend to count the time.
Yeah, surely, ma'am.
I will do the time.
Actually, I'm busy, I'm busy in writing your points. Whenever you are presenting the station, I am fully alert, and I have opened my notebook and pencil, and I'm writing the points. This is the reason that I'm now not able to start the timer. You people have to do
Ma'am,
it.
I can do the time.
Start. Okay. All right. So let's start, right? I'm writing your points. This is the reason my hands are busy. Start. Sorry. Just a minute. Sorry. Just a minute. This station we are not going to do. I have prepared. Just a minute. Actually, its details I have not entered. I want to do the station. That is, yes, this is the station we are going to do. I'm so sorry for that inconvenience. Okay, now let's start again.
Next page. Next page, ma'am. The investigation.